Yeah, good evening, Michelle. Basically, excess deaths is where we can look at what actually is happening at the moment in a particular week and can kind of compare that to what you would expect if you looked at the pre-pandemic numbers. And actually, of the deaths that we're seeing at the moment, we are seeing about 1,000 above what the numbers were pre-pandemic. A bit of that is explained, actually, Michelle, by the fact that the population's aging as we got more older people in the population than we had pre-pandemic overall. And then if you apply the actual death rates before the pandemic to the current population profile, that explains about a half of it. But there is still some excess that's going on across the country at the moment, Michelle. And if we look at taking COVID deaths out, because we know we've had recently the Omicron wave in the country, if we take all of those deaths out, we're actually seeing kind of deaths among the elderly below average, excluding the COVID deaths. But deaths among people aged 30 to 59, they are higher than what you would expect at the moment across the country from around the last 3 months.
What do we know about why?
Well, we can look at some of the causes across the population. The Office for Health Disparities gives us some information on that. And if we look at that, what we're seeing is, using some of the modelling that they've done, we're seeing higher than expected deaths linked to kind of heart issues, so heart disease, heart attacks. Diabetes is slightly higher than what you would expect as well. So those are some of the factors that, in terms of the causes. And then in terms of why this might be occurring as well, is if we look at the health system at the moment, the NHS is in a bit of a crisis. We've got a bit of an issue at both ends of the NHS in a way, Michelle. We've got more people going into A&E than what you would expect in the past because they can't get GP appointments. We've got fewer people leaving hospitals because they can't get discharged because of lack of care in the community. It's about 13,000 patients across the hospital. And then you've got that bit in the middle, Michelle, which is people who are in A&E, and if they need to be admitted to the wider hospital, they may not have got the bed, so they can't be moved out of the A&E to the wider hospital. Another ambulance turns up with some patients. They can't put them into the A&E system because the beds are blocked up. So you've got patients then on ambulances outside hospital, and we're hearing stories of that. And what that means then is, they say somebody has a heart attack, a stroke in the community, they phone for an ambulance, there's fewer of them, so the response times might be slower. And we do know if you don't get that ambulance quickly, you may obviously sadly die.